All right, let's talk about one of the most intense treatments in the fight against cancer, cytoreductive surgery with Hipec. Now, this is a major operation with a long road to recovery. But the way we approach that journey is changing, big time. It's all about getting proactive. And that brings us to the one question that's on every single patient's mind.
So let's just get right to it. We know Hipec can be a game changer for certain abdominal cancers. But if you or someone you love is facing this, the real question is, what are you really in for? What does recovery actually feel like? What are the biggest hurdles? And most importantly, how do you get through it successfully? Okay, so to even begin to understand the recovery, you first have to get a handle on the procedure itself. Because it's a massive undertaking, right? It's this powerful two-step combo that really explains both why it's so effective and why it's so intense. The best way to think about it is like a surgical strike followed by a targeted cleanup. First, you have the surgery itself. We're talking 6, sometimes 12 hours, where surgeons perform what's called cytoreduction. They meticulously go in and remove every visible speck of cancer they can find. But, cancer is sneaky. There are always microscopic cells left behind. And that's where step 2, Hipec, comes in. They literally fill your abdomen with a heated chemotherapy bath that circulates for up to 90 minutes, zapping those invisible cancer cells right where they live. It is an incredibly potent one-two punch. Now, as you can imagine, an operation that big means the recovery is going to be just as intense. And it is so important to be honest about the challenges. We have to face them head on, because knowing what you're up against is truly the first step to beating it. So the medical team is on high alert for a whole range of issues. You've got your direct surgical risks, like an anastomotic leak where the intestine could leak, and then you have the systemic challenges, like potential kidney injury from the chemo or infections. The entire goal of a modern recovery plan is to anticipate and get ahead of every single one of these. And here's exactly why being so proactive is critical. Look at this. A single major complication, like one of those intestinal leaks, can more than double your hospital stay. It goes from an average of 10 days to 23. That's a huge difference. So avoiding that kind of setback is everything. And we have to be realistic here. This is a marathon, not a sprint. You don't just bounce back from this in a couple of weeks. The fatigue can be just profound. And a lot of patients will tell you it takes a solid 6 months, maybe even a year, before they really start to feel like themselves again. It tests you, both physically and mentally. Okay, so we've laid out some pretty serious challenges, right? And hearing all that, you might be thinking, whoa, this sounds way too risky. But this is where the story takes a really interesting and frankly a very reassuring turn, especially when we start looking at the actual data. This quote from the research nails it. There's this idea out there, this perception, that Hipec is just this incredibly dangerous last-ditch effort. But a lot of that is based on older information, and it really lacks context. Now this is fascinating. This chart puts that risk into perspective. It compares the 30-day mortality rate for Hipec to other common major cancer surgeries. And just look at this. At 1.1%, Hipec's rate is actually lower than a Whipple procedure for pancreatic cancer or an esophagectomy for esophageal cancer. So yes, it is absolutely a complex, serious surgery. But, and this is key, when it's done at a high-volume expert center, its safety profile is right there with, or even better than, other standard major cancer operations. And that brings us to the most important part of this whole story. Knowing all this, how has medicine evolved to stack the deck in the patient's favor? Well, the answer is a proactive, 3-phase playbook that is completely transforming the recovery experience. You see, the modern approach doesn't start after the surgery is over. It starts weeks before. It's this whole journey broken into 3 crucial phases. First, prehabilitation to get your body ready. Second, ERAS protocols to make the hospital stay better. And third, a phased physiotherapy plan to rebuild your strength safely once you're back home. Let's break them down. First up is prehab, and the numbers here are just wow. Think about it like you're training for a marathon instead of just showing up on race day and hoping for the best. By improving a patient's fitness, their nutrition, their mental readiness before they even get to the operating room, the results are incredible. In one study, a prehab program cut the complication rate almost in half. That is an absolute game changer. So all that pre-surgery work then flows right into the hospital plan, which is focused on something called ERS, Enhanced Recovery After Surgery. And this isn't just one thing, it's a whole toolkit of proven strategies.
It means getting you up and walking the very same day as surgery to prevent blood clots. It means starting to eat sooner to wake up your system. It means using different kinds of pain control to rely less on opioids. Every single step is designed to reduce stress on the body and speed up healing.
And finally, that recovery continues at home, but with a structured step-by-step physio plan. This isn't just some vague advice to take it easy. No, this is a concrete roadmap. Phase 1 is all about super gentle movements like ankle pumps and short walks, just to keep things moving and prevent clots. Then Phase 2 slowly adds in gentle core work to rebuild stamina. And then Phase 3 is where you gradually progress to more advanced strengthening. It's a safe, guided path back to feeling strong again.
So when you put all of these pieces together, the prehab, the in-hospital ERAS protocols, the structured therapy at home, the whole philosophy of recovery just shifts. The focus isn't just on surviving a huge surgery anymore, it's about actively planning to have a great quality of life afterward. And that right there is the key takeaway. This whole modern strategy is all about empowerment. It completely changes the patient's role. You're no longer just passively receiving treatment. You become an active, prepared, and essential partner in your own healing. This comprehensive, patient-first approach is quickly becoming the new standard of care, and for good reason.
So you see, the goalpost has moved. It's not just about survival rates anymore. It's about giving patients the tools they need to actually thrive. Facing a procedure like Hipec is, without a doubt, daunting. But this proactive playbook gives you a clearer, evidence-based path forward. It's a journey of incredible challenge, for sure, but it's also a journey of incredible resilience. The only question left is, what will that journey look like for you?